Hello everyone. Again, my name is Christine and I chose to focus my communication systems video on manual sign language. So what exactly is it? Manual sign language is the most commonly used unaided augmentative and alternative communication strategy for individuals with autism, which means that it does not require any additional equipment or tools to help support communication other than the use of your hands. It has been used with individuals with autism since the 1970s and shown to be effective in infants all the way up to older adults. Many researchers have stated that the most beneficial age to introduce manual signing to an individual with ASD is during early toddler and young childhood years. In an article by Georgina Lynch, published in 2016, she states that since visual modality is often a strength for children with ASD, these simple gestures and signs can be used with repetition when paired with verbal reinforcement to help the child associate the sounds of words with meaning. This is known as total communication. Schlosser, I think I'm saying that right, and Lee stated that the autism research literature does provide some evidence that natural speech may develop concurrent with manual signing in the context of total communication. From my own experience with my nephew and other little ones that I've watched and cared for over the years, I have used the sign more, all done, eat, and milk, and have seen children actually pick it up fairly quickly. In a systematic review, Oliver Wendt discussed 4 reasons why manual signs are effective for individuals with ASD. First, manual sign language may be an easier option than speech because individuals with ASD struggle with imitating sounds. Second, it may be less difficult to teach the individual to imitate motor movements than word imitation. Third, manual signing may be less demanding of verbal memory and abstract understanding. And fourth, these signs may help to overcome a negative emotional history with speech that many of these individuals experience as a result of prolonged lack of progress. In a study conducted by Schlosser, and Lee again, they found that across all of their age groups, manual signing was significantly more effective than aided approaches with regard to acquisition. It may be easier to learn because it involves a single component rather than a multiple component motor response. Unfortunately, though, one disadvantage to manual signing, as described by Prelock and Macaulay in our book, is that even though these signs and gestures may seem simple, this form of communication is limited to only those who know sign language and can understand and interpret the sign that is being used. So I now want to demonstrate some manual signs used for individuals with ASD. So let's say maybe if a child wants to play more of their favorite board game, they will sign more. Say an individual is done playing with the board game and wants to move on to something else, they can sign all done. When they are hungry, you can teach them eat. And signs as simple as yes and no are important when responding to questions like, are you hungry? Do you want to go outside? And outside, I don't know if you can see that one, is also another one that I see a lot. And maybe, do they need a break? Break time. if they're looking for a break. Or maybe if they have a focal interest, let's say Pokemon or My Little Pony, you can help them make up what they call home signs, since there isn't a distinct sign for the more specific things. So for Pokemon, I know that they all have their own sort of superpower, I guess you could say. So maybe create something like superpower or something along those lines. So when it comes to manual sign language, we want to make sure that those who have daily contact with the individual being taught manual signs also knows that what signs are being used, even if that means we need to teach them the signs as well. So thank you for listening, and I hope you learned a little bit more about manual signs.